Good afternoon, students. Today I will discuss the shoulder joint. So it is a multi-axial synovial joint. You know it already. So the shoulder joint is forming in between the glenoid cavity on the medial side and the head of the humerus lateral side. When you are talking about the synovial joints, the order should be like articular surfaces and the ligaments, bursas, relations, and then movements, and then blood supply, nerve supply. So this is the order you should write in exams for all the synovial joints. So first, coming to the articular surfaces, it is forming between the two bones. So the head is formed by the head of the humerus, and one more socket is formed, ball and socket. Ball is formed by the head of the humerus. Socket is formed medially by the glenoid cavity. So this is about the articular surfaces. Next, coming to after the articular surfaces, we will see the ligaments. So there are important ligaments. So actually, if you see here, this is the clavicle, and below the clavicle you can also see subclavius muscle. See, this is the subclavius muscle. So this is the clavicle, and this is the acromion process of the scapula, and this is the coracoid process of the scapula. Acromion process, coracoid process of the scapula, this is the clavicle. So in between the acromion process and the coracoid process, there is a ligament. This is called the coracoacromion ligament, which is very strong, and it is like a tent on the superior part of the shoulder joint. So this coracoacromial ligament is called coracoacromial arch. Arch means both coracoid process, ligament along with the acromion process. Okay, coracoacromial arch, it means that coracoacromian ligament plus coracoid process plus acromion process. Okay, this arch is like a secondary socket. Okay, secondary socket. It is forming the main stability of the shoulder joint because it is preventing the further over abduction of the shoulder joint. Okay, along with the supraspinatus tendon coming above the spinous process, coming from the supraspinatus fossa above the spinous process. Okay, so this is the ligament, and this is the bursa. This space is called bursa, gap is called the bursa. Okay, so this is forming the secondary socket along with the supraspinatus tendon, and the stability of the shoulder joint is maintaining by this arch along with the bicep brachii tendon. Okay, so this bicep brachii tendon is present inside the capsule and also giving support to this arch along with the supraspinatus tendon inside the arch, which is inserting into the greater tubercle, this side. Okay, it is coming from the supraspinous fossa and will be inserting into the greater tubercle along with the infraspinatus and the teres minor muscle below the spinous process of the scapula. These are the infraspinatus and this is the teres minor muscle. From here you will have the supraspinatus muscle. Supraspinatus, infraspinatus, teres minor. 6 muscles are inserting into the greater tubercle. Okay, so the main stability of the shoulder joint is formed by this coracoacromion arch along with the bicep brachii tendon along with the rotatory cuff muscles. Okay, rotatory cuff muscles are nothing but sit muscles on the greater tubercle and the subscapularis on the lesser tubercle. This is subscapularis. This one. This is latissimus dorsi. This one is latissimus dorsi, and this one is the subscapularis, which is inserting into the lesser tubercle here. This is greater tubercle. Okay, that is the stability of the shoulder joint by the arch and the rotatory cuff muscles. Okay, so coming to the ligaments, first ligament is this arch. Arch is over now, like coracoacromian arch, and the second ligament is this capsular ligament. Okay, so this is the thick ligament attached around the head of the capsula. So attachments of the capsular ligament is medially it is attached to the glenoid labrum. If you see here, so medially it is attached to the glenoid labrum, and laterally this is attached to the anatomical neck of the humerus except 3 areas. where the bicep brachii tendon is there laterally, and also inferiorly where it is extend up to the surgical neck of the humerus. Okay. So actually this capsular ligament is merging with the rotatory cuff muscles on the greater tubercle and the lesser tubercle. And coming to the capsular ligament will become thickened and form 3 glenohumeral ligaments. So you cannot see glenohumeral ligaments from here. When you separate head and socket of the shoulder joint, then only it would be visible. I will show you here. So here you can see the glenohumeral ligaments. Okay. So this is the thickened part of the capsular ligament on the anterior surface of the capsular ligament. This is the superior glenohumeral ligament, and this is the middle glenohumeral ligament, and this is the inferior glenohumeral ligaments. Okay. Glenohumeral ligaments are nothing but the thickening of the capsular ligament on the inner side of the joint capsule on the anterior surface of the joint caps. Okay. 2 ligaments are over. And the third ligament is this one, which is present between the coracoid process, tip of the coracoid process onto the just in front of the greater tubercle. So this one is the coracohumeral ligament, third ligament. Okay. And fourth ligament is here you can see, this is the transverse humeral ligament, which is present in between the greater tubercle and lesser tubercle. Okay, inside that transverse humeral ligament you will have the bicep or the bicep brachii tendon. Okay, so these are the ligaments. This ligament is actually not the part of the shoulder joint, but I will show you here. This is present in between the clavicle and the coracoid process. This is the coracoclavicular ligament. So the coracoclavicular ligament will have 2 parts. This is the trapezius part, and this is the conoid part of the coracoclavicular ligament. Okay. So actual ligaments of the humeral joint is, one is the arch, coracoacromion arch, one is the capsular ligament along with the glenohumeral ligament. Okay. That is second one. First one this, second one is capsular ligament along with the glenohumeral ligament. Third one is the coracohumeral ligament, this one in between the coracoid process and the humerus. And fourth one is the transverse humeral ligament in between the greater and lesser tubercles. 4 ligaments. Okay. So after ligaments we'll see the relations. This is shoulder joint, this is deltoid muscle, na? So actually deltoid muscle is forming all relations like anterior, posterior, superior relations. First coming to anterior relations, first you will have the anterior fibers of the deltoid. After removing deltoid, you will have the, this is the cut part of the pectoralis major. We are separating this. This is pectoral minus, we are also separating this. So this the anterior relations of the shoulder joint is, one is the anterior fibers of the deltoid, and after that can you see these 2 muscles which are coming from the coracoid process. One is bicep brachii, one is the coracobrachialis. From here to, one second, from here to here, this is the coracobrachialis. Okay, from here to here you can see, and this is the long head and this is the short head of the bicep brachii. Okay, so this long head of the bicep brachii, this coracobrachialis, and this subscapularis muscle which is inserting into the lesser tubercle. These are all the anterior relations. Anterior fibers of the deltoid, bicep brachii along with the coracobrachialis, and also subscapularis. These are the anterior relations. Coming to the posterior relations, this is the spinous process of the scapula. Na? Below the spinous process, what muscles will be there which are inserting into the greater tubercle? IT, sit mein IT, infraspinatus and the teres minor. Okay, these 2 are forming the posterior relations. Coming to the superior relation, and also deltoid along with the infraspinatus, teres minor, along with the posterior fibers of the deltoid are forming the posterior relations of the shoulder joint. Coming to the superior relations of the shoulder joint, the middle fibers of the deltoid muscle along with the arch, nothing but the coracoid process, coracoacromion ligament, acromion process, coracoacromion ligament. Along behind the arch, what will be there? This space is called the bursa. Okay, so just below the subacromion bursa, This space is called subacromion bursa, and behind that you will have the supraspinatus muscle, which is inserting into the greater tubercle. Okay, these are all forming the superior relations. I will repeat the superior relations. So middle fibers of the deltoid, coracoacromion ligament, coracoid process, acromion process and ligament together called coracoacromion arch, and the subacromion bursa along with the supraspinatus tendon. These are all forming the superior relations. Coming to the inferior relations, you will have the long head of the tricep, okay, which is inserting into the infraglenoid tubercle. Okay, so this is the long head of the tricep which is inserting into the glenoid, infraglenoid tubercle, which is originating from the infraglenoid tubercle. Okay, this is the inferior relation. These are the relations. Ligaments over, relations over. Coming to bursas, this is one bursa. This is one bursa, nothing present below the acromion process, subacromion bursa, and one more bursa is present anteriorly just below the subscapularis muscle, and one more bursa is present posteriorly below the teres minor muscle. Okay, actually this subacromion bursa will continue with the subdeltoid bursa. These are all the bursa. Bursa over, ligament over, relations over. Coming to the blood supply, can you see two vessels here which are coming from the along the posterior side of the surgical neck of the humerus? This is the axillary nerve and this is the posterior circumflex humeral vessels. Okay, so now blood supply is by the subscapular artery, anterior circumflex humeral artery, posterior circumflex humeral artery. These are all branches from the third part of the axillary artery. Coming to the nerve supply, so one of the branch is coming from the axillary nerve, one of the branch is coming from the suprascapular nerve. The suprascapular nerve is running along the suprascapular notch, okay, and it is giving one branch to the shoulder joint, and one more branch is coming from the musculocutaneous nerve. Axillary nerve, suprascapular nerve and the musculocutaneous nerve. Okay, thank you.